Personnel at this station include a station leader, a monitor, a recorder, a driver, and a decontamination specialist. Tasks include decontaminating vehicles and equipment, documenting the results of the decontamination. For setup, obtain the instructions that are included in the setup kit. Post all signs and barriers. Ensure that a container is available to discard contaminated materials and PPE. If you are missing or need additional supplies, contact the Decon chief. Obtain survey meters and dosimetry from registration. Ensure all station personnel are wearing dosimetry and proper PPE at all times. If at any time you have questions about radiation, contact the radiation protection specialist. For procedural or setup questions, contact the Decon chief. When the station is set up and operational, notify the Decon chief. Review the VS&D form and locate the contaminated areas and levels for each area. The decontamination specialist decontaminates vehicles according to the procedures. Clean the exterior of the vehicle from the top to the bottom so as not to contaminate an area that is clean. The following methods can be used to decontaminate a vehicle. Dry or wet. For localized contamination, start with the dry decon process and progress to wet decon until the vehicle is clean. Remember to change gloves frequently during the decon process. For dry decon, wipe with dry cloth, remonitor, and discard cloth into contaminated waste container. For wet decon, spray the affected area with a cleaning solution. Wipe area with clean dry cloth and remonitor. If still contaminated, wash with soapy water, rinse with low-pressure water, then remonitor. If still contaminated, wipe with Radiac wash. Rinse with low-pressure water and remonitor. If still contaminated after 3 attempts at wet decon, cover the affected areas with plastic or paper and continue to decontaminate other contaminated areas before moving the vehicle to the dirty lot. Once the exterior is clean, move to the interior of the vehicle. For smooth interior surfaces, wipe contaminated area with damp cloth or paper towel and then remonitor. Discard cloth in contaminated waste container. If still contaminated, wipe with Radiac wash and remonitor. Discard towelette in contaminated waste container. If still contaminated after 3 attempts, cover the affected areas with plastic or paper and continue to decontaminate other contaminated areas before moving the vehicle to the dirty lot. For porous or fabric surfaces, vacuum with a wet-dry vacuum and remonitor. Be sure to use a vacuum equipped with a HEPA filter. If still contaminated, use a dry brush to scrub the area. Use vacuum again and remonitor. If still contaminated after 3 attempts, cover the affected areas with plastic or paper and continue to decontaminate other contaminated areas before moving the vehicle to the dirty lot. If elevated readings are observed in the hood area, check for contamination on the air filter. Once decontamination is complete, remonitor the areas to ensure they've been decontaminated adequately. Document the decontamination methods used and the results. When decontamination is complete, the vehicle may be released, returned to the field, or held at the EWD Center for further decontamination. Use the recommended contamination level guidelines posted at the station to determine the next action based on the outcome of the decontamination process. Instruct the driver to move the vehicle to the next appropriate station and bring keys to registration. Monitor the area. If necessary, decontaminate until it is at acceptable levels. When all areas are clean, a new vehicle can enter the station. At the end of the shift, brief replacement station workers report to personnel monitoring and then sign out and return dosimetry.